My name's Micah Brodoff. I sort of work here, and I'm from Olympia, Washington State in the United States. I was working for the Patient History Project, which is a new project at the clinic that seeks to improve patient-doctor care by interviewing patients about their health histories and their family health histories before they see a doctor, and creating a file with all that information and a card for the clinic. Well, the doctors here are all volunteer doctors, and they have very short shifts, and which they can see like 16 patients in a 4-hour period. So patients don't get a lot of time with the doctor. So removing the asking questions about what symptoms they're feeling and their medical histories part from the doctor's job is incredibly important for reducing the time that the doctor needs with the patient in order to give them care. I think the most important thing for me volunteering here is getting an insight into a couple of things. First of all, how a health clinic runs, which can be incredibly balagan. So understanding how a health clinic runs, seeing both the doctor-patient side of it and the administrative side of things, and seeing how they're kind of intertwined, but even though it's like a mini government in a way, with funding and then actually carrying out the action, which is patient care, doctor care. And the other thing is seeing how uninsured people get health care in Israel. I've really developed a passion for healthcare and how important it is for people to know that that healthcare is on their side, even when they have very little else in their life. They come here and just talking to someone about that they're sick, they leave with a smile even though they're sick, because they know that there's people on their side. It showed me that I would really like to be a part of that process for the rest of my life in people's healthcare. And I don't know in what respect, but in some way. Whatever status that is placed on a person, whether they're called infiltrator or refugee or asylum seeker, working at this clinic has made me also understand that everyone is human at the end of the day. And for example, I had a patient come who had hepatitis, and he broke down. I've had a few patients break down, but this one broke down in front of me because he had a huge outstanding hospital bill that he was unable to pay at the same time as providing for his family back home. And that was really hard for me to see him go through a basic struggle paying a bill. That's something that me, as somebody from Washington State, I've never had to deal with the problem of paying my bills and having that be an issue. That on top of his health and not getting healthcare except for coming here for the first time to get healthcare for his hepatitis. And it was just a moment of truth for me to realize that even it doesn't matter what status you ascribe to people. At the end of the day, they're humans and they need help, and that's what we're here to do. A lot of people come to this clinic as volunteers because they're in their early 20s and they don't really know, like me, don't really know exactly what we want to do with our lives. And we just are sort of well, let's go volunteer in another country and see what opportunities await us. And I would tell new volunteers that are like me, that don't really know what they're in for the rest of their lives, that to just give it a chance here, because in healthcare, it's an incredible opportunity. It's hard work. You learn a lot, but I say just give it a chance, and you might develop a new passion.